Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and Founder of Atlantic Coast Aesthetics. And Dr. Pane, this week's question for Ask Dr. Pane is, this person's lost about 200 pounds and wants to know what their plastic surgery options are. So first of all, congratulations for losing all that weight. And Dr. Pane, what would you suggest?
Yeah, another excellent question. Now, when you talk about serious weight loss, we're talking 75 pounds, 100 pounds. In this case, the person lost 200 pounds. Essentially, in terms of what their options are, well, their options are very wide. It's a question of what their priorities are with a couple of caveats. Now, in this case, sometimes when people lose that much weight, they actually have loose skin of the lower abdomen and the upper abdomen. They can have loose skin on the back and sides. So a lot of times people will try to, when they see that, they'll want you to do like a full all the way around body lift, extended tummy tucks with scars in the front of the abdomen as well as underneath. What we do is we don't pick a procedure based only on the amount of weight you lost, because really what the factor that has to be considered is how loose is your skin. Now, most people with 200 pounds, it's going to be a lot. And I'm going to talk about starting with the central abdomen first, because that's where you get the most mileage out of these procedures. That isn't always the case. If someone comes in and says, look, I lost 200 pounds, for Pane here, it's my arms. Well, fine, we can start on the arms. But for most people, they want the most bang for the buck, and that's going to be the torso. And that also is helpful because that gets them some pull of the upper thighs, so that if they later do the thighs, they'll get a better result than if they do the abdomen first than if they get the thighs first. Again, little tweaks here and there. With this patient, there's some looseness in the front of the abdomen, but not a lot on the sides and the back. I would probably talk about an extended tummy tuck here in this case. If the person, and they don't in this case, but if they already had an up and down scar, if they had some kind of old school general surgery, and by that I mean before we started doing a lot of things laparoscopically, or somebody had a trauma or something like that. If they already have an up and down scar for somebody like this, we would talk strongly about doing the inverted T tummy tuck. But this person does not have that upside down, does not have a vertical scar already, and they don't have a lot of upper abdominal skin laxity. So the inverted T tummy tuck is an option if they want to go as far as they can to contour the body, knowing that they're going to have an unhideable scar on the front of the abdomen. If they don't have a big secondary pannus of the upper abdomen, I don't try to push people into that inverted T scar, because that scar, again, is unhideable. I just talk about the pros and cons of both options, and then we go from there with what they choose to do in terms of what kind of scarring they want to accept. This person does not have a lot going on in the back or sides. A lot of people probably would say, oh, go ahead and do the circular all the way around body lift. I'm not a big fan of it if you don't need it, because it's got more complications, more scarring, and more issues. If you're not going to get a lot of results for it, you really don't need to expose yourself to a scar going around the back. If you get a wound healing problem, it's difficult to manage. That's fine when you have this looseness on the sides and in the back. But carefully consider. Again, we do everything in our practice, but we try to tailor our approach for what your needs are and what you want to accomplish. We don't have a one-size-fits-all in our practice by any means. That's true for everything we do. So that's what I would say here. Minimum extended tummy tuck, possibly the up and down scar if they want to go a little bit further, but I would do that before getting involved with the thighs or the arms, unless those areas were their super priority and they were not concerned about the abdomen. So that's how I would approach it in this case.
Excellent. Well, thank you, Dr. Pane. We appreciate your time. And if you have a question for Dr. Pane, please visit our website, Facebook page, LinkedIn, or Twitter account. And Dr. Pane, we'll see you on the next question.
Great.